Hi there, everybody, and we thank you for joining us today for Healthline 3. I'm Jessica Crandall. It's a liver disease that affects more than 130 million people worldwide. And today we are talking about the topic of hepatitis C with Dr. David Dees. Dr. Dees is with gastrointestinal specialist. He'll be answering your questions for the next half hour, and we'd like to encourage you to ask what's on your mind. If you're online, just click on the orange Healthline 3 box. It's about halfway down on the right-hand side of your screen. Type in your question and submit it. I'll ask it on air to Dr. Dees. Or give us a call. The number to dial is 318-219-4569. We'll keep that right up there on your screen for the remainder of this show. And this is a call-in broadcast. We'd love to hear from you, and we'll be taking your questions until 12:30 today. Dr. Dees, so good to have you with us today.
Thank you for having me.
Let's dive right into the subject. What is hepatitis C?
It's one of several viruses that can get in the body and attack the liver. Now, some of these viruses can attack other organs, but we're mainly talking about the liver.
What are the symptoms of it?
You know, most people don't have any symptoms at all. That's the problem. So unless there's a risk factor, they might not get tested. But if it becomes advanced, they can get fatigue, joint aches. If it's advanced, jaundice even.
So what are the risk factors for hepatitis C?
The main risk factor is illicit drugs. Snorting is a very strong risk factor. Injecting drugs, you think of people in the 60s and 70s, and that is exactly why the CDC now has an official recommendation. If you were born between 1945 to 1965, you should get tested. Even with normal enzymes, you don't think you have any risk factors, those people need to be blood tested.
I was surprised by that number. I was researching hepatitis C before the show. I was surprised that there is that many people who have this around the world.
Yeah, we're not sure exactly how many in the United States. The studies range between 3 to 6% of our population. So if you think 300 million, do the math. I mean, there's a lot of people in the U.S. with Hep C.
Absolutely. So is there one group that's more at risk of getting it than another?
Well, substance users, absolutely, illicit substance users, but people who've had distant blood transfusions, maybe your mother could have gotten a blood transfusion when she delivered. You got to keep in mind, we didn't even discover it till 1990, so our blood supply was contaminated prior to then. It's now clean, and it would be hard to get Hep C from a blood transfusion today.
This may be a novice question, but what's the difference between hepatitis C and the other letters that we hear about?
Yeah, they're named for that exact reason. They're just different. Hep A is something you get by eating contaminated food, not too common in the United States. Hep B is more sexually transmitted, but can be transmitted from mother to baby at the time of birth. We call that vertical transmission. Any of them can be transmitted by illicit substances, injection.
So what about men, women, certain ethnicities? Is there any group like that that's more prone to getting Hep C?
Men certainly are, because they're more likely to try illicit substances. Lower socioeconomic class, it's much higher, but they're more likely to try illicit substances. We see it a little more in the African American community, but let's be clear, no one's immune, not at all. And there's no gender difference in your ability to contract it. There's no protection by being a woman or a man.
How are you able to diagnose hepatitis C? You mentioned that sometimes people don't have any symptoms.
It's a blood test, and it's a special blood test. So many people are frustrated because my doctor didn't pick it up. Well, that's not a standard blood test. You have to be thinking they have a risk factor, we're going to draw the blood test. Some people just have elevated liver enzymes, they have no symptoms, and that's why the doctor draws the blood test.
Okay. If anyone is just tuning in right now, I'm here with Dr. David Dees from Gastrointestinal Specialist right here in Shreveport, and we're discussing the topic of hepatitis C, which is a form of liver disease. Is that correct?
That's correct.
Okay, if you have a question about hepatitis C or something else that you'd like to ask Dr. Dees, the number to dial is right there on your screen. It's 318-219-4569. We'll be here until 12:30 today answering your questions and also discussing this topic. So Dr. Dees, is hepatitis C curable?
Oh, absolutely. You know, in the early days, we probably only cured 4 to 5%, and that number rose to the 50 percentile when we had long-acting interferons. But people called that chemotherapy. It was so hard to take. They had so many side effects, and we don't use any of that. Since probably last year, we now have easy to take oral medicine. That means pills. Most people are only going to take 12 weeks. Some people take as little as 8 weeks, and we cure over 90% of them now.
Wow, that's an incredible number.
Yeah, easy to take.
I know I've seen some of the commercials for hepatitis C medications. Tell me about those. Are there any side effects? What is the treatment like?
Well, any medicine can have side effects, but the short answer is no. They're extremely well tolerated. Some fatigue, some complain of headache. It's not bad at all, but for 8 weeks, 12 weeks, I could put up with a little fatigue to get cured of hepatitis C.
Yeah, sounds like a good balance there. How hard is it to take the treatment? That goes hand in hand with the question I just asked.
You know, they're all pills. One is a once-a-day pill. The other brand that's competing is twice a day. Either way, easy to take. They're working on newer therapies for just 4 to 6 weeks. The Germans actually have it's very early, have come up with a single injection to cure hepatitis C. We don't know the side effects. It's too early in development, but the future is shorter and shorter therapy.
And so with these latest advancements, getting treated is easier than ever for patients, would you say?
No question about it. The problem is we've only cured 9%. We've only treated maybe 20%, and we only know of about 40 to 50%. Most people out there don't even know they have it. They've not been tested. That's a problem.
What are some of the risks if someone has it for years and doesn't ever get tested or treated for it?
Oh, the liver disease can become more advanced, and that's the problem. You don't want to wait till you're jaundiced. You don't want to wait till you have end-stage liver disease. As in all things in medicine, the earlier we detect, the easier it is to cure. Now, we are curing people now with cirrhosis. The medicine is just that good. In fact, I'm the medical director of the liver transplant program. We're going back and treating all of our liver transplant, post-transplant, just to get rid of it.
You mentioned jaundice, discoloration of the skin.
Right, a yellow color, or icterus, some people call it. Look in the whites of your eyes. That's the easiest place to see it. Jaundice is a little more difficult to see in people of darker skin, like an African American, but you can always look at the whites of the eyes and see it.
Okay, good deal. What is the risk of cancer associated with this?
There is a risk. For Hep C, typically does not occur until you have cirrhosis or at least advanced liver disease. And we think the risk is about 3 to 4% per year. The good news is most people won't get cancer at all. But the goal would be to cure you before that ever happened.
Good deal. What is the risk of needing a liver transplant? You had mentioned that earlier, that you're on the board for that. Is that correct?
Yeah, I'm the medical director. So overall, if you have 100 people with Hep C, we expect 11 out of the 100 to go on to a bad liver thing, and I define that as liver transplant, liver cancer, liver failure, some bad life-ending or life-altering liver event. So most will not. Risk factors for progression are not what you would think. Alcohol, definitely. Smoking is now a risk factor for progression.
Wow.
It's a strong risk factor. We didn't know that when I was in training, but smoking scars up every part of your body. Why wouldn't you think it would scar your liver? It's the filter of your body. So don't smoke. Some people worry about Tylenol. That is a wives' tale. You will never hear a liver doctor tell you can't have Tylenol.
Wow.
It's alcohol, tobacco, those sorts of things.
What about other types of pain relievers?
Yeah, that's a great question. The Mayo Clinic has studied that, and they realized that people with Hep C who take narcotic pain pills, not over-the-counter, prescription pain pills, have a 3 times increased relative risk of death, and we're very concerned about sleeping pills as another category. There's not many medicines that are cleared by the liver, but narcotic pain pills and sleeping pills are. Nerve pills like Xanax, Ativan, Valium, these are hard on the liver.
We have a caller on the line now. This is a call-in show, as we mentioned earlier. So let's head on out to our phone lines, Dr. Dees. We have Linda on the line. Linda, how are you, and what can we help you with today?
I was calling up. I had 2 sons that died from hepatitis. They had a liver cancer, and neither one were heavy drinkers. They both had cancer started in the liver and spread over their bodies. Now, they were born with a hepatitis C trait, and I was wondering, could they change to hepatitis B over the years?
So one hepatitis doesn't change to another. It would stay the same as it is. And you mentioned you were born with a hepatitis C trait. So we don't call it that. You're either a carrier, which you can be and not actually have the disease anymore, or you can be active. And we determine which of the two you are by a simple blood test called an RNA. Now, we know that 10% of people who get hepatitis C will get over it themselves, their own innate immunity. You don't need any medicine. In order for me to tell which one you are, it takes one blood test. And if you're cured, you are cured forever, unless you get it again some other way.
Okay. Okay, thank you.
Thank you.
Thanks, Linda. Great question. If anyone else out there would like to dial in to our call-in broadcast today, the number to dial is right there on your screen. It's 318-219-4569. I'm here with Dr. David Dees from Gastrointestinal Specialist right here in Shreveport, and we're discussing the topic of hepatitis C. So, Dr. Dees, you mentioned earlier that some people with progressed Hep C need liver transplants. Once you do that, are they then cured from Hep C?
Absolutely not. 100% reinfected rate. And the reason is the virus is circulating in their blood, and as soon as you put the new liver in, they become reinfected. So in the old days, that was a problem, but now we're going back and curing those already transplanted. I would say, let me get you cured before it ever gets to that point these days.
Exactly.
Don't wait.
And once someone is cured, you touched on this, can you get it again?
So it won't recur within your own body. You would have to reinfect yourself. So for example, someone who likes to snort cocaine gets it, I cure them. They go out and snort more cocaine, they can get it again, absolutely. You're not immune to getting again.
Okay. Dr. Dees, one more time, just for our viewers who are just tuning in, will you describe what hepatitis C is?
It's a virus. A virus is an infection that's so small you can't see it with the naked eye, and it can get and harbor in your body and reside. And different viruses like to live in different places. For example, influenza likes to get in your lung. Well, hepatitis, by definition, loves to live in your liver. That's where it replicates. Hep C is a little different than the other viruses. It has to replicate to survive. If you kill replication, it cannot survive. So all these new drugs stop replication.
Okay, good deal. Let's go on out to our phone lines one more time. We have another caller. This is Becky, who's on our phone line now. Becky, how are you, and what is your question for Dr. Dees?
I'm doing okay. I was just wondering about the cost of the treatments. How would you go about that?
Cost, unfortunately, is not defined by your doctor or your pharmacy, but by what kind of insurance you have. Your insurance company negotiates. The companies that make the drugs actually are very generous. They have copay payment plans. They'll pay your copay up to a certain amount as law allows. And I'd have to know what insurance, and even if you told me I had a certain insurance, there's different plans, but we would figure that out for you. If you see a physician, he's going to get it pre-authorized by your insurance, and they're going to call you with a number. And there's actually even programs with all these companies now. If you're of low income, they'll just give you the medicine.
Okay,
they're very generous.
Thank you.
Thanks, Becky. If anyone else would like to call in, the number to dial is right there on your screen. It's 318-219-4569. I'm here with Dr. David Dees from Gastrointestinal Specialist here in Shreveport. We're talking about hepatitis C. Dr. Dees, what are some of the latest advancements in treating hepatitis C?
Well, this is it. We call it the DAAs, direct acting antivirals. In the old days, we gave the shots, the interferon shots, which the patients called chemotherapy, and they were hard. They made you lose your hair. You were irritable, depressed. Many people had to come off therapy in the middle of it. They couldn't tolerate the side effects. I suppressed your bone marrow. The new therapies have none of that. The DAAs, the pills, are so easy to take. And I told you we're working, now it's typically 12 weeks. We're working to make it 6. There's a company now working to make it 4 weeks of therapy. The Germans are working on a single injection. So it used to be the most common reason for liver transplant, and now we think we're going to transplant no one for this within 5 years.
Wow. it
We'll
is
cure 'em all.
advancing quickly. Yeah.
Yeah.
Love to hear that. Okay, let's go on out to another caller now. We have Joanna on the line. Joanna, how are you, and what can we do for you?
I feel okay, but I had a quick question. Maybe he can answer. I wanted to know, do alcoholics get hepatitis? And if so, which one would it be? Because since alcohol affects the liver, I was just wondering, can alcoholics get hepatitis?
Yeah, that's a great question. So there's more than one answer. Alcoholics can get alcoholic hepatitis, which can injure the liver by chemical toxicity. But if you study just alcoholics, they are more likely to get hepatitis C. And the reason is, if you're willing to drink that much alcohol, you're more likely to do other things. Try some drugs, snort something. So we screen all of our alcoholics for hepatitis C and B and A.
Okay, so one other question. So that means that if you're alcoholic, it would be important that you go on and try to get a blood test just to make sure that you don't have a hepatitis and whatever type it is. Is that correct?
That is absolutely correct. So I couldn't argue with you at all. The study is called the Dionysos study, and that Dionysos was the Greek god of imbibing. So they went to a town in Italy where there was a lot of drinking and a lot of hepatitis C, and they studied people with each and people with both. And you would think two bad things would double my chances of getting cirrhosis, but we were wrong. It was 10 times worse. There's something about alcohol that makes hepatitis C grow like wildfire. It is the dumbest thing you can do if you have hepatitis C to drink. The second dumbest thing you can do is smoke.
Okay. Oh, this is great, because I was wondering. I got a loved one that's an alcoholic, and we're concerned about his liver.
He needs to have the liver tested, even if he doesn't have hepatitis C. He needs to know what stage he's in.
Okay, and I think I heard you say something about hepatitis can be transmitted through a sexual activity?
Not Hep C. Hep C is very poorly transmitted. The current CDC guidelines are that there's no special precautions needed. If a wife has hepatitis C and a husband does not, we don't recommend any precautions at all. Hep B, totally different story. B is definitely transmitted sexually. It's the most common means of transmission in this country, but not Hep C. Hep C can be transmitted from mama to baby at the time of birth, but it doesn't do it very often, less than 5% of the time.
Yes. Oh, okay. Oh, thank you so much.
Yeah, God bless you.
Yes, okay, thank you. Bye-bye.
Okay.
Well, good deal, Joanna. Sounds like you were really able to help her out there. We appreciate the phone call. If anyone else would like to call in today, the number's right there on your screen. We're going to keep it up there until the end of the show. We have about 12 minutes left for you to get your question into Dr. D's. We are discussing hepatitis C, and we have covered this topic pretty extensively, but if you still have a question, please dial in. The number to dial is 318-219-4569. And Dr. D's is with gastrointestinal specialists, which are located here in Shreveport, right?
That's correct.
Okay, talk to me about what's unique about what you guys do. I was looking you up before the show, and looks like you have a really good big group there.
Well, I appreciate the compliment. We made the decision a long time ago to follow the model of the Mayo Clinic. As you know, the Mayo Clinic wants their physicians to what we call super subspecialize. You're not just a gastroenterologist. For example, myself, I went on for formal training in hepatology. There's only 166 hepatologists in the country. It's a very small group. We have others who've decided to super subspecialize in inflammatory bowel disease, esophageal cancer, pancreas cancer. We have the only 2 board certified endoscopic ultrasonographers north of New Orleans. So it's not common in a city this size to have people that truly super subspecialize. That's what we're looking for in our group.
Explain hepatology for us.
Hepatology is the study of liver disease. When people ask me what I am, I have to tell them what I am, then I have to explain to them what that is. And when my children were little, they couldn't say the word, so they just said, Dad's a liver doctor.
That's all we need to know. That's perfect then. Okay, so just to go along with Joanna's question, which she was asking for a loved one who was an alcoholic, and you mentioned that they should get their liver checked out if they're an alcoholic. Should smokers get checked out too? You mentioned that that was a factor.
I don't think that smoking by itself causes cirrhosis. It is a strong something that would enable cirrhosis if there were another reason. So for example, alcohol, Hep C, that sort of thing. But by itself, smoking will not cause cirrhosis.
Okay, good deal. We have another caller on our line now, so let's go on out to our phone lines. Caller, how can we help you today?
Hello. I was just I just tuned in, so I don't know if my question can be answered or if this is appropriate to what you're discussing at this moment. But I have a family member who is almost 3 years old, and she has just been diagnosed with Crohn's disease. And I was wondering, does any stress or trauma in a person psychologically, could that be a reason for a child that young to get Crohn's disease?
No, Crohn's disease is an immunologic disease. Your own body's immune system is attacking your gut. It's not caused by an infection. I was involved in a research project for a year looking for an infectious etiology of Crohn's, and we never were able to find one. We looked and looked, and many others have looked. But it's not common for children to manifest at that age, but they certainly can. Risk factors would include if there's a family history. If the mother smoked, that is a risk factor, or father smoked, that is a risk factor for a child to have Crohn's disease. Regardless, just like in my field, we actually have good therapies for Crohn's disease now that we didn't have when I was in training. So it's not a curable condition, but it is definitely a treatable condition.
And does your clinic treat children that age or pediatrics?
We do not. There are 2 pediatric gastroenterologists here in Shreveport. They're both at Willis Knight and South, but we don't see them until they're adults, closer to 18 years old. We used to see kids a long time ago, but the lawyers made us stop because they told us none of you guys are formally trained in pediatric GI, and they made us stop.
Well, the reason I asked is because we do have another family member, a young lady that's about 26 that has Crohn's in our family.
Yes, she can
and
come.
Her specialist has asked her if there was any trauma in her life or if anything happened traumatic, because he, for some reason, links the two together.
Well, I don't, but I'm going to refer you to one website that'll be bigger than you could read in many weeks, and it's the site the docs go to for information, and it's called the Crohn's and Colitis Foundation. And all these questions are answered on that place there.
Okay, Crohn's and Colitis Foundation.
Yeah, Google that, you'll find it immediately.
Okay. And I really appreciate your talking with me and your time helping the public with these issues. It's very kind of you to do that, and I appreciate the news station for doing this as well.
Thank you.
Absolutely. Great question. Thanks for calling in.
Thank you very much.
Have a good one. Let's go on out to another caller who's been waiting on the line now. We have Sharon on the phone for Dr. Dees. How are you, and what's your question?
I'm so sorry. I'm fine.
Well, good. How can we help you?
I was listening to the TV broadcast, too. I just had a question as a Hep C patient. Is it a good idea, if you are diagnosed with Hep C, to have other family members checked, to have them go through the same liver tests to see if there is any problem with them having
No,
any
you
kind
can't.
of problem?
You can't transmit it through the family, and it's not a genetic disease. The only person you could give it to would be if a woman has a child. It can be at the time of birth, and there's no difference in cesarean versus vaginal delivery. And the incidence is 3 to 5%, depending upon whose study you read. So even if you tell me you're sexually active with a man, he is not going to get it. He would have to have a risk factor. It's just not transmitted that way. Hep B, different story. We do want you to test the family.
All right. Well, you mentioned transmitting it to a child at birth.
Mm-hmm.
What about if a mother with Hep C is nursing an infant child?
So we've never been able to prove that that is a means of transmission, and that has been looked at. But easy to check. Anybody who wants to be checked, it's just a blood test.
Right.
And they could come into you to get that done?
They can. They could go to the health unit and get it done. If you've ever donated blood, you were checked. You just didn't know you were checked.
Oh, there we go.
Well, yes and no. Apparently, that is how I became a Hep C patient, is from receiving a blood transfusion. But I received the transfusion before they were checking for Hep C.
Yes, so she's making a very good point. Prior to 1990, 1 in 6 units of blood were infected. We just didn't know. That's all screened out now since 1990. At 1990, the test was pretty good, not great, but now the screening process is great. It would be so hard to get Hep C through a blood transfusion now.
Good to know. Sharon, any other questions for Dr. Dees?
Not that I can think of at this time. Thank you very much.
We appreciate it. Thank you. Got about 3 minutes left in our show here. Dr. Dees with the gastrointestinal specialist here in Shreveport is with us. We've been discussing hepatitis C, and I'd like to remind everybody, if you missed part of this broadcast, you can catch it online at ktbs.com. We'll have the full broadcast up there with Dr. Dees. So in our last couple minutes here, talk to me about how what gastrointestinal specialist does, what people can come in and see you and your colleagues for.
So we're all things digestive, pancreas, liver. The main thing in any GI group, of course, is colorectal care, screening for colon cancer, peptic ulcer disease, reflux disease. But as I mentioned, we have super subspecialists who do nothing but pancreas, liver, inflammatory bowel disease, that sort of thing. I'm all things liver, from just mild fatty liver all the way to a liver transplant. I take care of those. And
any kids, or do you treat adults? What spectrum?
It has to be adult. They asked us to stop seeing children, so we did, and there's no need. There's pediatric GI here now in this city, so definitely above 18, but if you were above 17 heading to 18, we would probably see you.
And in the last minute we have here, what are the high points that you'd like to get out there to our viewers about hepatitis C that they need to know?
The main thing is to get tested. Most people out there still don't know. If you have a risk if you were born between 1945 and 1965, no risk factors, go get tested one time, please. If you have ever snorted drugs or injected drugs, go get tested. Blood transfusions prior to 1990, go get tested. If your liver functions are elevated, go get tested.
And the main things to stop doing that exacerbates hepatitis C?
Stop the smoking, stop the drinking. Those are the main two right there. And when I say smoking, I include marijuana. It is smoke. And we know that it raises your risk of liver cancer threefold if you have hepatitis C.
Okay, good to know. We'd like to remind everybody that you can catch this broadcast at ktbs.com. Talk to me about the best way for people to get in touch with you and your colleagues.
We have a website, gis.md. We're certainly in the phone book. We have multiple offices. Even now in Minden, we have an office. We're expanding. No referrals needed to come see us. So.
Okay, and phone number, do you know it?
631-9121.
Okay, address, do you know that?
3217 Maybell, M-A-B-E-L Street.
Okay, great job. Dr. David Dees with gastrointestinal specialist. We so appreciate you being here today.
Thank you.
Got a lot of phone calls. We appreciate all our viewers calling in today. One more time, go to ktbs.com if you'd like to learn anything more about hepatitis C. We hope you have a very great day. Bye.